So now skin health equity doesn't stop at the diagnosis. It can extend to policy, access, systemic change. So what role does advocacy or public policy, particular some of the activities that the Skin of Color Society can do, play in translating that awareness into lasting change?
Yeah,
Well,
I mean, oh,
yeah,
please,
go
Dr.
ahead. No, no, no. Go ahead, Dr. Bullock.
I was just going to say, I mean, I think advocacy is essential. And I'm so thankful to all of the organizations in dermatology that are doing advocacy. I mean, if you look at most of them, almost all of them have an advocacy arm or committee because we need that many individuals in all of these different spaces coming from different angles to advocate for our profession. We do have an advocacy committee at the Skin of Color Society, which we're really proud of. And obviously, our focus is related to things that impact patients of color. But I think that, it takes a village. And I think it's something where, we need to have strength in numbers and we need to come together and even partner with other societies on these advocacy efforts.
So I was going to give you a living, breathing example. So as you may know, in the military, there's been a directive that men with PFB who don't improve after a year can be discharged from the military. So the academy, in conjunction with several different professional societies, dermatology societies, have sent representatives so that we could create or do a Delphi for treatment. So we're engaged in that to give our opinion about the most effective treatments for PFB. Dr. Bullock and I are a part of this effort. The Academy has also requested a discussion with the Department of Defense because this is a disease that affects not only individuals with skin of color, but many different men, right? It's not anything that they are doing wrong. So that type of advocacy is sort of kind of living and breathing example of what we can accomplish when we work together.
And I love that it brings equity across the board. Like you said, it's not just skin of color patients, it's all men, and they should be able to be a part of the military or do
Right.
what they feel is their calling in life without having a skin disease holding them back. Now, I know sometimes innovation can actually help with some of these challenges that we face. It can close the gaps, sometimes it can widen them. And as dermatology continues to innovate, how can we ensure that new technologies like AI even can help to reduce these health disparities?
Well, I think we have to keep asking the tough questions, right? Like when new things come out, we can't just become immediate adopters. We need to look at, what are data sets, for example, that are feeding AI for dermatologic programs, making sure that there's not bias in the things that are going into things. So I think all of us as dermatologists being critical thinkers and really, being in different spaces. We all can't be in, everywhere at once. But I think if we can be asking these questions and pushing back to the companies that are creating the technology and devices, which could be great. It could help us, right? And help our patients, but making sure that they're done through a lens where there isn't bias that's created or perpetuated is going to be really important.
Dr. Bullock mentioned spaces. I think it's critically important that we be in rooms and spaces that make the decisions, decide what to investigate, decide what to invest in. So I think that's also a key for the future.
Yeah, I couldn't agree with you more because I do think that that bias piece that comes into the equation. If you look at Google, for example, you put in the word psoriasis, and it takes a while for you to see a skin of color patient. So if we're feeding in the wrong images that are not diverse, then someone on the other side isn't going to actually see what they need to see. And for psoriasis specifically, a patient may not think that's a disease they have if their skin is not represented. That bias can actually impact thousands when it gets built into an algorithm, so to speak. So I know we are coming up to the end of our time. So I want to first thank you guys for joining me. But as we look ahead into 2026, let's talk about a couple of things that we can do, like real world activities. So is there one educational or advocacy action that you think people can do on a grassroots level that would help them make a difference? Small scale, we're talking.
I do. I mean, so I would say one clinical action is take time to think of one disease state that you just don't feel comfortable with, that you just don't know as well, you don't see as much, and take the time to learn about it. See what the newest journal articles are about it. Go to a session about it. Just take a proactive stance to do something different about a space that you might be uncomfortable in. And in this case, if it's anything related to skin of color, we welcome individuals to do that. But it could be about, again, anything that you're passionate about. The second thing I'd say with advocacy is join any committee or organization where you can be part of those spaces that Dr. Taylor's talking about. I think a lot of people feel that they can only make a difference at high levels of leadership where you have to be running something in order to have a say. And that's not true. I think every member of every organization, their voice matters. And so even if you are, again, just having one slice of the pie by joining one committee and really dedicating yourself to that, you're making a difference. And so whoever can help do that for us, especially in the education advocacy realm, will be doing really important work.
As dermatologists, we are all a part of a larger community, the dermatology community. And I think that if a patient comes in and you're not sure about the diagnosis, if it's a skin color patient or not, then you can call on your colleagues. You can call on us. You can run the case by us. I don't care if you've been out a year, if you've been out 30 years, right? We're part of a community. I've never had anyone when I've reached out not take the call, not talk to me, and vice versa. I've taken all of those calls. So I want to say we're not alone. We're not isolated. We are here to serve our patients, to serve all patients. And if you're not sure, reach out.
I actually think we're privileged in dermatology that we all like to help each other and we
Yeah.
actually like each other. One thing I actually do in my clinical practice is sometimes we do like a skin of color case review once a quarter. I've looked at my own images, tried to make sure I diversify my own portfolio. So when I get on the podium, I can make sure that I'm accurately representing the patients I see. I think, though, to your point, Dr. Elbullock, that it's not about big things. It can even be something really small, but done consistently that can still make a change. I think sometimes we're waiting to make these grand movements, and oftentimes that doesn't happen. So even the smallest shift can definitely make an impact.